Welcome back to the EMT Spot's Blood Pressure Podcast. I'm Samuel Harrison, your host,
And I'm Olivia Harper.
and we're about to jump into a deep dive on a topic that may seem a little paradoxical at first.
Yeah,
Permissive hypertension.
that's right. We're going to be exploring how, in some cases, specifically when it comes to stroke recovery, doctors might intentionally allow a patient's blood pressure to run a little higher
Yeah.
than what we normally consider healthy.
Now, before anyone listening thinks this is permission to just ignore your blood pressure meds,
Right.
let's be crystal clear. This is a carefully controlled medical procedure,
Absolutely.
not something you try at home.
Right.
Over 116 million Americans have hypertension, and if left untreated, that can lead to some serious problems.
Yes.
Strokes, heart attacks, and other cardiovascular issues.
You're exactly right. It's important to understand that permissive hypertension is a very specific strategy used in a very specific context.
Yeah.
We're talking about ischemic strokes here, the kind caused by a blood clot blocking an artery in the brain.
Okay, so let's unpack the logic here.
Yeah.
Why would intentionally elevated blood pressure even temporarily be considered after a stroke?
It all boils down to blood flow and the brain's incredibly high demand for oxygen.
Right.
Think of it this way. The brain is like a high-performance engine that needs a constant supply of premium fuel.
Yeah.
In this case, oxygen-rich blood
Right.
to function properly.
Right.
A stroke, however, throws a wrench in the works by disrupting that fuel supply.
And it's not like we can just crack open the skull and reroute the blood flow.
Right.
The brain is encased in bone, making it especially vulnerable
Exactly.
when those blood vessels get blocked.
What's fascinating here is that after an ischemic stroke, the body naturally tries to compensate for the blockage by increasing blood pressure. It's like it's saying, okay, if the normal route is blocked, we need to create more pressure
Yeah.
to force the blood through.
So permissive hypertension is essentially working with the body's natural response,
Yes.
amplifying that signal to get more blood to the brain cells that are desperately in need.
Precisely. The goal is to strike a delicate balance, enough pressure to restore blood flow,
Yeah.
but not so much that it causes damage. Too
Yeah.
little pressure, and the brain is starved of oxygen.
Right.
Too much, and you risk swelling, bleeding, and a whole host of other complications.
Okay, so how do doctors actually implement permissive hypertension? What does this look like in practice?
Well, there are a few key treatments often used in conjunction with permissive hypertension. One is thrombolysis,
Okay.
which involves administering clot-busting medications intravenously to break up the clot causing the stroke.
That's incredible. It's like sending a tiny plumber into the bloodstream to
Yeah.
clear out the blockage.
It's a remarkable advancement in stroke treatment, no doubt. Another treatment is recanalization,
Okay.
which aims to restore blood flow in blocked arteries more directly. This might involve procedures like angioplasty, where a tiny balloon is used to open up the blocked artery, or stenting, where a small mesh tube is inserted to keep the artery open.
So it's like giving those blood vessels a little scaffolding to hold them open.
That's a good way to think about it. And then the third key treatment we often see with permissive hypertension is a focus on maximizing collateral vasculature.
Now, collateral vasculature sounds a bit complicated. Can you break that down for us?
It's actually quite intuitive. It's about encouraging the body to use alternative blood vessel pathways. Think detours
Okay.
to bypass the blockage. The human body has an amazing ability to reroute blood flow when needed, and this treatment focuses on maximizing that capacity.
So while permissive hypertension is working on increasing the pressure, these other treatments are focused on clearing the blockage itself
Right.
and finding new routes for the blood to travel.
Exactly.
Like a multi-pronged approach then. But all this, of course, has to be done with extreme caution.
Of course.
What are the safety guidelines when it comes to permissive hypertension?
You're absolutely right. Safety is paramount. Permissive hypertension is only done under strict medical supervision following guidelines set forth by organizations like the American Heart Association.
Okay.
These guidelines emphasize the importance of constant monitoring.
Okay, so constant monitoring. What exactly does that entail?
We're talking about regular blood pressure checks,
Mm-hmm.
continuous heart rate monitoring, and frequent neurological assessments
Okay.
to make sure the patient is responding well and to catch any signs of trouble early.
And I imagine fluid balance is important too, right?
Absolutely.
Dehydration can complicate things pretty quickly.
Maintaining proper hydration is crucial. We need to ensure the patient's blood volume is optimal to support blood flow to the brain.
So far, we've been talking a lot about the what and the how of permissive hypertension. But let's dive into the why a little deeper.
Okay.
Earlier, you mentioned that the body naturally tries to increase blood pressure after a stroke.
Yes.
Can you elaborate on that a bit?
Sure. After a stroke, the body's immediate response is to try and restore blood flow to that affected area of the brain.
Right.
One way it does this is by, well, you guessed it, increasing blood pressure. It's
Mhm.
like the body is saying, we need to get more blood to that area stat,
Okay.
and cranks up the pressure to try and force more blood through.
So, in a way, permissive hypertension is simply amplifying the body's own distress signal.
Yes,
It's like giving the body's natural healing mechanisms a little boost.
that's a great analogy. It's about supporting the body's innate ability to heal.
Right. But of course, any intervention has potential downsides.
Of course.
Are there any situations where permissive hypertension might not be the best option?
That's a crucial question, and one we'll explore further in part 2 of this deep dive.
Okay.
We'll also look into some specific cases and delve into the long-term implications of permissive hypertension.
All right.
We'll even touch on some of the ethical considerations surrounding this approach.
Sounds good. So be sure to join us for part 2, where we'll continue to unpack the fascinating world of permissive hypertension.
Until then, stay curious.
Welcome back to the TheEMTSpot's Blood Pressure Podcast. We're picking up right where we left off, exploring the world of permissive hypertension. It's amazing how the body responds to something as serious as a stroke, and doctors are learning to work with those responses in fascinating ways.
Absolutely. We've established that permissive hypertension is about temporarily allowing higher blood pressure after an ischemic stroke, all with the goal of increasing blood flow to the brain.
And we talked about how this approach isn't just about overriding the body's natural instincts. It's more like amplifying a signal the body's already sending.
Exactly. It's like fine-tuning a complex instrument working in harmony with the body's own healing mechanisms.
So let's dig into the research behind this. What are scientists discovering about permissive hypertension? What kind of evidence is there to support this strategy?
Researchers are uncovering more and more evidence to suggest that in specific situations, permissive hypertension can significantly improve recovery outcomes for stroke patients. One study, for example, followed patients who received this treatment during their hospital stay and found they were more likely to regain function and independence compared to those who didn't have permissive hypertension.
That's impressive. But stroke recovery isn't just about the immediate aftermath. What about the long term? Are there any indications that the benefits of permissive hypertension could extend beyond the initial recovery period?
That's a question researchers are actively exploring, and while more research is always needed, some studies do suggest that the benefits might be more lasting than initially thought.
So it's not just about getting through the acute phase. It can actually improve someone's quality of life down the road. That's a powerful concept.
It is. Of course, this all ties back to the delicate balance we discussed earlier. Enough blood pressure to encourage healing, but not so much that it causes harm.
Right. It's that tightrope walk between promoting healing and preventing further damage. We've touched on some of the more serious risks associated with uncontrolled hypertension, things like hemorrhagic transformation and hypertensive encephalopathy. But are there other, perhaps less severe side effects that healthcare providers need to be aware of when implementing permissive hypertension?
Even though we're talking about controlled and monitored hypertension, we still need to be vigilant. One concern is the potential for an ischemic stroke, the kind caused by a clot to transform into a hemorrhagic stroke where an artery ruptures and causes bleeding in the brain.
That sounds incredibly dangerous.
Yeah.
So it's really about staying one step ahead, constantly monitoring and mitigating those risks.
You've got it. It's a high-stakes balancing act that requires a deep understanding of the patient's individual situation. Now, I know we've been discussing the science and medical aspects of permissive hypertension, but I think it's helpful to bring this to life with some real-world examples.
I agree. Sometimes those personal stories can really highlight the impact of these medical strategies. Do you have a particular case that comes to mind?
Let's imagine a patient, we'll call her Sarah, who was recently hospitalized after an ischemic stroke. Her medical team is considering permissive hypertension as part of her treatment plan.
Okay, I can picture Sarah. She's likely feeling anxious, scared. You're just hoping for the best possible outcome.
Absolutely. And her doctors know that restoring blood flow to the damaged part of her brain is critical for her recovery, but they're also very aware of the risks of allowing her blood pressure to go too high.
So they're in a tough spot. It's a decision with a lot riding on it. What happens next?
In Sarah's case, the medical team decides to move forward with permissive hypertension, but they do it very carefully. They monitor her blood pressure, heart rate, and neurological status like hawks, constantly adjusting medications and fluids to maintain that crucial balance.
It's like they're conducting an orchestra, fine-tuning each instrument to create a harmonious whole.
Hmm.
I'm guessing this careful approach paid off for Sarah.
It did. Her blood pressure remained within safe limits, and she started showing positive signs of improvement. Of course, not every case is as straightforward as Sarah's. There are situations where permissive hypertension might not be the right call. Remember those patients with left ventricular assist devices we mentioned earlier?
Right, the LVADs. You mentioned those need extra consideration.
That's right. For these patients, increasing blood pressure can actually have the opposite effect, reducing blood flow to the brain. It highlights the importance of individualized treatment plans and recognizing that what works for one patient might not work for another.
This brings us back to the concept of a personalized approach to medicine. What works for Sarah might be completely inappropriate for someone else.
Exactly. Permissive hypertension is a powerful tool, but it needs to be used with precision and care.
Okay, so we've covered a lot about the acute phase of stroke and permissive hypertension's role in that initial recovery. But what about the bigger picture? How does permissive hypertension fit into the long-term rehabilitation process?
That's a great question. Stroke recovery is a journey, not a destination. And there's growing evidence that permissive hypertension could play a role in long-term outcomes as well. One study found that patients who had slightly higher blood pressure in the first few days after their stroke actually tended to have better functional outcomes 6 months later.
Really, that's counterintuitive. Wouldn't higher blood pressure put them at greater risk for complications down the line?
It seems that way, right? But again, we're talking about controlled permissive hypertension, not uncontrolled high blood pressure. It's about finding that sweet spot where we're maximizing blood flow to the brain without pushing it over the edge.
So it's almost like we're giving the brain the resources it needs to repair itself and allowing that natural healing process to unfold.
You're getting it. And that brings us to the future of permissive hypertension.
Now, that's what I'm really interested in. What's on the horizon for this treatment? What breakthroughs or advancements are you most excited about?
Well, one exciting area is personalized medicine. Imagine being able to identify specific biomarkers that can predict which patients are most likely to benefit from permissive hypertension.
That would be amazing, tailoring treatment to each individual's unique biology. It's the future of healthcare, isn't it?
It really is. Another area I'm particularly interested in is the development of new technologies for monitoring blood pressure during permissive hypertension. Think wearable sensors that can provide continuous real-time data, allowing for even more precise management.
That would be a game changer. It would give doctors an incredible level of insight into how a patient is responding to treatment.
And think about what that would mean for patients. Imagine being able to track your own blood pressure trends and share that information directly with your doctor in real time.
It's like having a personalized health coach on your wrist.
Exactly. And as technology continues to evolve, I think we can expect to see even more innovative solutions emerging, further refining our approach to permissive hypertension.
This has been such an eye-opening discussion. I feel like we're just scratching the surface of this topic.
We are, and there's still so much more to explore.
Well, luckily for us, we have part 3 of this deep dive to continue unpacking all this. What can our listeners look forward to in the final part of our exploration of permissive hypertension?
We'll dive into the future of this approach, look at what research is on the horizon, and discuss some of the long-term implications for stroke recovery.
Sounds fascinating. I can't wait.
Me neither. So be sure to join us for part 3, where we'll wrap up our discussion on permissive hypertension.
Welcome back to the EMT's Blood Pressure Podcast for the final part of our deep dive into permissive hypertension. I got to say, this has been one of those topics that really flips the script on what we think we know about, health and the body.
It definitely challenges conventional thinking, doesn't it? We've spent the last 2 parts talking about how this seemingly counterintuitive strategy, allowing higher blood pressure after a stroke, can actually be beneficial in some cases.
We've explored the science, the safety guidelines, and even heard a real-life example with Sarah's case. But now I'm really curious about what the future holds for permissive hypertension. What's on the horizon for this approach?
That's a great question, and there's a lot to be excited about. One area that holds immense promise is personalized medicine. Imagine a future where we can identify specific biomarkers. Think of them as biological clues that tell us which patients are most likely to benefit from permissive hypertension.
That would be incredible. It's like tailoring the treatment to each individual's unique biology.
Right.
Maximizing the benefits while minimizing the risks.
Exactly. It's about moving away from a one-size-fits-all approach and embracing the complexity of human physiology. Another exciting area is the development of new and improved technologies for monitoring blood pressure during permissive hypertension.
You mentioned wearable sensors earlier, right? The kind that could provide continuous real-time data.
Precisely. These sensors would give healthcare providers an unprecedented level of insight into how a patient is responding to treatment, allowing for even more precise management of their blood pressure.
It would be like having a constant stream of information flowing from the patient to their doctor.
Yeah.
And what about from the patient's perspective? What could these advancements mean for them?
Well, imagine being able to track your own blood pressure trends in real time and share that information directly with your doctor. It would empower patients to take a more active role in their own care, wouldn't it?
Absolutely. It's like having a personal health coach right on your wrist, guiding you through the recovery process. It's incredible to think about how far we've come in terms of medical technology and how these advancements are shaping the future of stroke care.
It really is an exciting time to be in this field. As technology continues to evolve, I have no doubt that we'll see even more innovative solutions emerging, further refining our approach to permissive hypertension and improving outcomes for stroke patients.
Now, alongside these advancements, we also need to consider the ethical implications of this approach. Permissive hypertension challenges traditional thinking about blood pressure management, and it's important to have open and honest conversations about the potential risks and benefits.
You're absolutely right. One of the key ethical considerations is informed consent. Patients need to be fully informed about the potential risks and benefits of permissive hypertension, and they need to be actively involved in the decision-making process.
It's about making sure that patients understand what they're agreeing to, and that they feel empowered to ask questions and voice their concerns.
Exactly. It's a partnership between the patient and the healthcare team working together to make the best decisions for their individual situation.
Well, as we wrap up this deep dive into permissive hypertension, I'm struck by the incredible progress that's been made in stroke care. It's truly a testament to the dedication and ingenuity of medical professionals around the world.
I agree. And for anyone listening who might be going through a stroke recovery journey or knows someone who is, I think this episode highlights the importance of staying informed, asking questions, and being an active participant in your care.
Well said. It's been a fascinating exploration, and I want to thank you for sharing your expertise with us.
It's been my pleasure. I always enjoy diving deep into these complex and thought-provoking topics.
And a huge thank you to all our listeners for tuning in to the EMT Blood Pressure Podcast. We hope you found this deep dive informative and engaging.
If you enjoyed this episode, we encourage you to subscribe, like, comment, and share it with anyone who might be interested in learning more about blood pressure and related health topics.
I'm Samuel Harrison.
And I'm Olivia Harper.
Signing off from the EMT Blood Pressure Podcast. Until next time, stay curious, stay informed, and stay well.